Africa Mental Health Reform Consortium, a leading initiative of civil society organizations across Africa, works to gain commitment and actions on mental health legislation, investment and integration into healthcare systems. Mr. Amme Abba, convener of the association, spills all on this liberating move.
As of today, we have 15 African countries that have personally signed up, and we believe that the numbers will continue to grow as we look forward to having a representation of all the African countries across all the horns of Africa on this consortium. Why? Because the need to drive mental health reforms across the African continent as the bedrock or as the driver of development across Africa cannot be emphasized, and hence we're looking forward to expanding membership towards getting the involvement of all the other African countries that are yet to join, and other African associations of mental health institutions to also be part of these, as we are not in doubt of the potency of this movement as it relates to the mental health policy, mental health plan, mental health legislation, and optimally mental health care of the African people. And hence we are very deliberate and strategizing on the increment of membership across board.
Abba explains the challenge of mental health acceptance, diagnosis and cure in the African continent.
We still have ignorance, bedeviling a very huge population of Africans as it relates to mental health. And this is very sad. And appalling the more is the fact that this particular population across Africa and also other parts of the world are not just only lacking, the necessary information around mental health, the facts, the facts around mental health, but they are not willing to know. That is the most painful part. They do not know, they do not have the knowledge about it, but they are not really willing to learn or to open up to conversations around it. And we'll have a lot of concerns and back and front, trying to engage the traditional leaders, the religious leaders, people who before now have been engaging on non-orthodox ways to try to look into mental health issues.
He further harps on the need for psychoeducation.
There is a very huge gap in terms of psychoeducation in Africa with relation to mental health. The issue of religion also is another very serious matter that we are face to face with in terms of promoting mental health in Africa. We are such a unique people that believe so much and uphold religion, and it's very hard for you to engage religious clerics, and having them to want to see the real fact about mental health beyond their scope of knowledge, which is very limited. Not only limited in terms of their own personal awareness, but limited also in terms of the support they try to give to persons around their communities. Communities here I refer to the worship centers. It's a really great concern. So we have a range of reasons why we are leading this movement, and why we believe that this is timely, and why we believe that this has to be taken more seriously. I think that will also address and answer some of the reasons why we're actually leading this campaign across the African continent.